Good evening to one and all. Once again, welcome back to our YouTube channel NANDA Nursing Life. So फटाफट वीडियो को लाइक कर दियो और शेयर कर दियो जो मैंने लाइव आस जाइछो. लाइक कर दियो बेटा फटाफट. Please like the video and share the video. So आज तो हमें स्टार्ट करबा मेडिकल सर्जिकल नर्सिंग रा किछि मोस्ट इंपोर्टेंट MCQ जोटा अपन मानकर OSSC नर्सिंग ऑफिसर रिक्रूटमेंट एग्जाम रे आसीबो. राइट ना बेटा से सब क्वेश्चंस मोस्ट इंपोर्टेंट मोस्ट प्रोबेबल मोस्ट क्रूशियल MCQ सब डिस्कशन करबा मेडिकल सर्जिकल नर्सिंग रा. राइट तो स्टार्ट कर देबो आउट देरी नाही. Right, first question बेटा आज एक फर्स्ट क्वेश्चन हु इज नोन एज द फादर ऑफ एसेप्टिक सर्जरी. ऑप्शन है हिपोक्रेटस, ऑप्शन बी रही जोसेफ लिस्टर, ऑप्शन सी रही लुइस पास्चर, ऑप्शन डी सोलमैन वॉक्समैन. सो व्हिच ऑप्शन इज द करेक्ट आंसर? So correct answer is Joseph Lister. Joseph Lister is the father of aseptic surgery. Right? Option B is the correct answer. Option B is the correct answer, beta. Option B is the correct answer. Joseph Lister, right? Next question. Question number 2 is while assessing the level of consciousness of a patient using Glasgow Coma scale, which of the following score represents the best motor response from the patient? Option is 3, option C is 5, option B is 4, option D is 6. So which option is the correct answer? Motor response. Motor response. No motor response बेटा. No response हेले कौन कितने आसीबो स्कोर? No response हेले 1 not 0. Best response from the patients. Option D, very good. Extension हेले 2 flexion कर दि पारुत होता हेले 3 ताहेले 3 हेबो. Then withdrawal from pain हेले 4 and localized pain हेले 5th and obey's command हेले 6. So best motor response केते हेबो बेटा? Motor response रा total score केते 6 maximum score है ना नहीं motor response रा. So 6 जदि score होचे ताहेले patient obeys the command ना obeys command. Right, so option D is the correct answer. Right, option D is the correct answer. Next question, question number 3 रे अछि obeys command बेटा भूल रे type is rod shaped bacteria are called. Rod shaped bacteria are called. Option is cocci, option B is clusters, option C is bacillus, option D is spirochetes. So which option is the correct answer? So correct answer is beta option C, bacillus. Rod shaped bacteria are called bacillus. Right, rod shaped bacteria are called bacillus or bacilli. Right, option C is the correct answer. Next question, question number 4 is which of the following is the correct sequence for phases of the bacterial growth curve? Option is stationary, decline, lag and log. Option B is lag, log, stationary and decline. Option C is log, lag, stationary and decline. Option D is decline, log, lag and stationary. So which option is the correct answer beta? So correct answer is option B होगा बेटा. Option B is the correct answer, right? Option B is the correct answer. Lag, log, stationary phase, then death phase, or that is decline phase. Death phase or decline phase, right? This is the bacterial growth curve, right? Bacterial growth curve. This is the bacterial growth curve. Right? Bacterial growth curve मुझे देखिए बेटा टाइम, right? Then it log numbers of cells ए एक्सिस रे कौन हुए बेटा हम कौन देखुचे log numbers of cells, right? ए एक्सिस रे हम देखिबा टाइम हैला. तो फर्स्ट leg हवा बेटा, then log हवा, right? Then stationary phase अच्छी, this is stationary phase, and ये जो धीरे धीरे downwards होची means death phase or decline phase बेटा, death phase or decline phase, right? This is the bacterial growth curve. Next question, question number 5 रे अछि, name the drive that becomes active when the physiological balance within our body called homeostasis is distributed. So disturbed. Name the drive that becomes active when the physiological balance within our body called homeostasis is disturbed. Option is social drive, option is physiological drive, option is personal drive, option is unconscious drive. So which option is the correct answer beta? The correct answer is physiological drives. Physiological drives. Physiological drives beta. Correct answer कौन होगा? Physiological drives होगा. Right. Next question. Question number 6 is the 4 cardinal sign of inflammation are most important MCQ. ला start ही गला बेटा. Important MCQ सब. The 4 cardinal signs of inflammation are option is heat, redness, swelling, and discomfort. Option is pain, coldness, redness, and pus formation. Option is pain, heat, redness, and swelling. Option D is pain, paleness, cold, and swelling. So which option is the correct answer? फटाफट आंसर कर दिया. 4 cardinal sign of inflammation. 4 cardinal sign of inflammation. फटाफट आंसर कर दिया. Very good. Option C is the correct answer. Option C is the correct answer. Pain रहिबो, heat रहिबो, redness रहिबो, and swelling रहिबो. Right? So option C is the correct answer. Next question. Question number 7. Alarm resistance and exhaustion are concepts related to. Alarm resistance and exhaustions are concepts related to. Option is health belief model. Option B is trans theoretical model. Option C is health promotion model. Option D is general adaptation syndrome. So which option is the correct answer? फटाफट आंसर कर देला. This is the general adaptation syndrome. Yes. Right, option D is the correct answer. Option D is the correct answer. Alarm reactions, resistance, and exhaustions. These all are comes under general adaptation syndromes. And this is a model better, right? General adaptation syndrome models. Right, option D is the correct answer. Next question, question number 8 beta. The third phase of body adaptation to stress is option is reaction, option is rebound, option is exhaustion, option is resistance. So which option is the correct answer? हमें भी देख ही लेना. short term and long terms reaction to stress alarm reactions, resistance and exertions. So the third phase of body adaptation to stress is which option beta? Exertions हमें देख लेवा exertions first is alarm, then resistance, then exertion. So option C is the correct answer according to general adaptation syndrome model. GAS model, gas model किए डेवलप करथिले बेटा जानि छ Hansel develop करथिले right. This is developed by Hansel. Right, gas model or general adaptation syndrome model developed by Hansel. Right. Next question, question number 9. Health is a state of complete physical, mental and social well-being and not merely the absence of disease and infirmity. This was stated by option A United Nations, option B National Institute of Health, option C National League for Nursing NLN, option D World Health Organization. So which option is the correct answer? कार डेफिनेशन बेटा अब किए देइथिले एटा हेल्थ इज स्टेट ऑफ कंप्लीट फिजिकल मेंटल एंड सोशल वेलबीइंग एंड नॉट मेयरली द एब्सेंस ऑफ डिजीज एंड इन्फॉर्मिटी कार डेफिनेशन एटा आंसर कर दो भाई आंसर तो कर दो ऑप्शन डी हम हम जाने जे ऑप्शन डी एका करेक्ट आंसर कार डेफिनेशन एटा कहि देला फटाफट आंसर करो समस्त आंसर करो जते जण देखुछ नै कि समस्त आंसर करो मु जानिबा पई चाहू छी तो कार डेफिनेशंस डेफिनेशन तो लेखा है ना एटा तो देइथिला वर्ल्ड हेल्थ ऑर्गेनाइजेशंस नंदिनी नायक हेल्थ वेरी गुड हेल्थ रो डेफिनेशंस मु एटा चाहूथि त माने समस्त कमेंट करो मन रखिछ ना नहीं ना भूली गेलो मासे 2 मास रे भूली गेलो हो के एबे एम नर्सिंग पास आउट हिचे ना हेल्थ रो डेफिनेशन वेरी गुड हेल्थ रो डेफिनेशन health is a state of complete physical, mental and social well-being and not merely the absence of disease and infirmity. This was stated by World Health Organization and this is the definition of health. Next question, question number 10 is the role of the medical surgical nurse that uses critical thinking, clinical judgment and the nursing process as key tool for nursing practice is option A is practitioner role, option B is leadership role, option C is managerial role, option D is research role. So which option is the correct answer? Which option is the correct answer? फटाफट आंसर कर दिया so correct answer is option A practitioner role. Practitioner role. The practitioner role is the fundamental role of a medical surgical nurse. Practitioner role. Option A is the correct answer. Next question, question number 11 is SOAP is a standard method of documentation. SOAP stand for option B stable data, ordinal data, assessment and projective data. Option B stable data, ordinary data and anecdotal data and professional data. Option C is subjective data, objective data, assessment and plan. Option D is seclusive data, overt data, anecdotal data and prospective data. So which option is the correct answer? Beta most important MCQ. Very important MCQ. आंसर कर दियो so SOAP stand for आंसर करो फटाफट ऑप्शन सी सब्जेक्टिव डाटा ऑब्जेक्टिव डाटा असेसमेंट एंड प्लान राइट ना ऑप्शन सी इज द करेक्ट आंसर तो ठीक नेक्स्ट क्वेश्चन क्वेश्चन नंबर 12 द ऑर्गन्स दैट कैन बी डिटरमाइंड बाय deep palpation of the abdomen are the organs that can be determined by deep palpation of the abdomen are option A large intestine, sigmoid colon and rectum, option B liver, spleen and kidney, option C stomach, duodenum and pancreas, option D stomach, small intestine and colon. So which option is the correct answer? फटाफट आंसर कर दो फटाफट आंसर करो बेटा फटाफट So correct answer is option B, liver, spleen and kidney. Deep palpation of the abdomen is a technique used to assess the liver, spleen and kidney. Right? Option B is the correct answer. Next question, question number 13. In deep palpation method, the depth of skin depressed is approximately. देखो सही related. Deep palpation method related questions. And आमे deep palpation करले liver, spleen and kidney जान देखुचे, assess करि पारुचे with the help of deep palpation techniques. हाँ ना नहीं तो हमको केते depth of skin depressed approximately करले आमे properly palpate करि परिबा, जानि परिबा, detect करि परिबा abdominal organs को. Option A is 2 to 3 cm, option B is 4 to 5 cm, option C is 1 to 2 cm, and option D is 3 to 4 cm. So which option is the correct answer, beta? Option B. Very good. Option B is the correct answer, beta. Option B is the correct answer. Option B is the correct answer. 4 to 5 cm. जदि हमें properly 4 to 5 cm जे deep palpation करिवा ताहले हमें abdominal organs को assess करि परिबा properly and any abnormalities की किछि masses जदि थिबो ताहले हमें जानि परिबा माने नहीं right. Next question, question number 14. Urea breath test. Urea breath test is done for identifying infection of the gastric mucosa with dash microorganism. Salmonella, Escherichia coli, option C is Shigella, option D is Helicobacter pylori. So which option is the correct answer? Urea breath test is used to detect the presence of Helicobacter pylori in the stomach. In the stomach, right? Option D is the correct answer. In the stomach. And this bacterium produces ureas. And this bacterium produces ureas. Urea. Right? Next question, question number 15. While using the nursing process, a nurse formulates nursing diagnosis based on which of the following? Option A, physician's diagnosis. Option B, patient identified medical problems. Option C, subjective and objective assessment data. Option D, treatment plan from interdisciplinary team. So which option is the correct answer? Beta, which option is the correct answer? फटाफट आंसर कर दिया. फटाफट आंसर कर दिया. While using the nursing process, a nurse formulates nursing diagnosis based on which of the following? Correct answer is subjective and objective assessment data. Option C is the correct answer. Option C is the correct answer, beta. So हमको nursing diagnosis formulate करवा गुरु हमको कहाँ बेस रे हमें कोचे subjective data and objective data ही करूँ हाँ ना नहीं. So option C is the correct answer. Next question, question number 16. NANDA stand for. NANDA stand for. Option A, North American Nursing Diagnosis Association. Option B, New African Nursing Directive Association. Option C, North African Nursing Diagnosis Alliance. Option D, New American Nursing Directive Alliance. So which option is the correct answer? बड़ा आंसर कर दे. नंदा नर्सिंग लाइव रे यदि वीडियो देखुछा ना नंदा रो फुल फॉर्म भी जाने उचित. नंदा रो फुल फॉर्म को बेटा. NANDA stand for की जाने चाहिए आंसर करो. ठीक ठीक, वेरी गुड. North American Nursing Diagnosis Association, right? Na. So option A is the correct answer. NANDA stand for North American Nursing Diagnosis Association. Right? So option A is the correct answer. Next question, question number 17. Which of the following association was established to develop, refine and promote the taxonomy of nursing diagnostic terminology that nurses use? Option A रची USAID, option B रची ANA, option C रची NANDA, option D रची ICN. फटाफट आंसर करो बेटा. Which option is the correct answer? Which option is the correct answer? Right, correct answer is option C, NANDA. NANDA, NANDA. No, no. Next question, beta. So question number 18 is, while doing whoever test by tuning fork assessment and checking for vibration sense, which one of the following frequency tuning fork is commonly used for screening of hearing impairment? Option A रचे 128 Hz, option B रचे 2056 Hz, option C रचे 512 Hz, option D रचे 1028 Hz. So which option is the correct answer बेटा? फटाफट आंसर कर दे लो. Very good. So option C is the correct answer. Next question, question number 19 रचे beta thalassemia is an autosomal recessive disorder. It is characterized by reduced hemoglobin levels in the body and is also known as option रचे aplastic anemia, option रचे sickle cell anemia, option C रचे Police anemia, option D रचे hemolytic anemia. So which option is the correct answer? Which option is the correct answer? Cooley's anemia. Very good. Option C is the correct answer. Option C is the correct answer. So beta thalassemia is an autosomal recessive disorder. It is characterized by reduced hemoglobin levels in the body, and it is also known as Cooley's anemia. Right? Cooley's anemia. Next question, question number 20 रही बेटा. An unconscious patient moves his extremity spontaneously, open eyes with verbal response and speak inappropriate words. Then what is the GCS? Then what is the GCS? Option A 10, option B 12, option C 11, option D 8. So which option is the correct answer? Extremity spontaneously coach means beta score केते हबो 6 आना नहीं 6 हबो score. Then open eyes with verbal response तो केते बेटा score 3. Then speak inappropriate words ले ताहले केते हबो एटा भी स्कोर 3 है हाँ ना नहीं 3 है बता. ओपन आई कहते हैं उससे बेटा आई रेस्पॉन्स देन स्पीक inappropriate words. तो कहते हैं 3 + 3 + 6 केते गला बेटा 12 हो जाए नहीं. सो टोटल केते हेबो 12 हबो जीसीएस राइट 12 हबो आना नहीं. मोटर रेस्पॉन्स केते 6 आना नहीं. मोटर रेस्पॉन्स 6 तापर आई रेस्पॉन्स 3 आना नहीं. देन verbal response 3 6 + 3 + 3 12 हिगला राइट. सो 12 हबो दिस टोटल जीसीएस. नेक्स्ट क्वेश्चन नंबर 21 अछि alarming value of GCS requiring ICU admission is. Alarming value of GCS requiring ICU admission is. Option A 15, option B 13, option C 12, option D 8. So which option is the correct answer? केते जीसीएस हेले बेटा आईसीयू रे हमको एडमिशन करे को पड़िबो निहाती भाबरे. आंसर कर दियो फटाफट. ओके करेक्ट आंसर इज ऑप्शन डी राइट. जीसीएस 8 ही गला ताहले बेटा हमको निहाती भावरे जीसीएस 8 और लेस देन 8 ही गला पर हमको निहाती भावरे इंटेंसिव केयर यूनिट एडमिशन करे को पड़बो. एंड पेशेंट को हमको क्लोजली मॉनिटरिंग करे को पड़बो. एंड जहां भी तार कॉम्प्लिकेशन अच्छे रिलेटेड एयरवे रिलेटेड हो कि जहां भी कॉम्प्लिकेशन हो तो हमको मैनेज करने को पड़ो एंड क्लोजली मॉनिटरिंग करने को पड़ो पेशेंट को यही लेवल जीसीएस पेशेंट को अन्ने जार जीसीएस यही लेवल रहिबो बेटा एवं लेस देन 8 रहिबो कि 8 ही गला ताहले हमको क्लोज मॉनिटरिंग करने को पड़ो एंड मैनेज करने को पड़ो जहां कॉम्प्लिकेशन थिबा पेशेंट राइट. नेक्स्ट क्वेश्चन नंबर 22 रे व्हाट इज द मिनिमम पॉसिबल स्कोर ऑफ ग्लासगो कॉमा स्केल. ऑप्शन ए 3, option A 3, option B 1, option C 2, option D 0. So which option is the correct answer? Which option is the correct answer? आई ओपनिंग रा मिनिमम स्कोर केते बेटा आई ओपनिंग रा मिनिमम स्कोर 1 आना नहीं. वर्बल रेस्पॉन्स रा मिनिमम स्कोर verbal response ro minimum score 1, then motor response ro minimum score 1, right? The total minimum score of GCS केते हे बेटा 3 ना. Option A is the correct answer. Option A is the correct answer ना. ठीक. Next question, question number 23 है formula to calculate BMI. Most important, very important MCQ question आसुची ऑनर रखिबार अछि. Very important. How to calculate BMI? A formula to calculate BMI. Body mass index. Body mass index. कौन बेटा BMI रो full form है body mass index. और formula कौन calculation formula weight in kg height in meter square. है ना. ये तो फॉर्मूला. ऑप्शन ए इज द करेक्ट आंसर. वेरी गुड. ऑप्शन ए इज द करेक्ट आंसर. आना नहीं. नेक्स्ट क्वेश्चन मन रखिता एक क्वेश्चन आसुची बेटा हैला मन रखिता. नेक्स्ट क्वेश्चन नंबर 24. Which of the following elements comes under secondary subjective data? Option A, the nurse palpates edema in lower extremity. Option B, the nurse measures weight. Option C, client states severe pain while climbing. Option D, spouse states the client has lost all appetites. So which option is the correct answer? फटाफट आंसर कर देला. So correct answer is option D. Spouse state that the client has lost all appetites. This is right. So option D is the correct answer. This is the comes under this element which comes under secondary subjective data, right? Option D is the correct answer. Next question number 25, which is the formula for calculating body mass index. Already हमें देखी सालेने. So option A is weight in kg by height in meter square. Option B is height in gram per height in gram by height in meter square. Option C is height in kg by height in centimeter square. Option D is height in kg by height in millimeter square. So which option is the correct answer? So correct answer is option A, right? Option A is the correct answer. Height in kg by height in meter square, right? So option A is the correct answer. Next question number 27 अच्छी बेटा. All the measurable and observable information about the client on his or her state of health. Option A biographic data. Option B primary data. Option C objective data. Option C is objective data. Option D is subjective data. So which option is the correct answer? यार 26 नंबर क्वेश्चन छोड़ दिए हो, कोई बात नहीं. डायरेक्ट 27 हो. So which option is the correct answer बेटा? All the measurable and observable information about the clients on his or her state of health. It is objective data, right? Option C is the correct answer. Objective data habo beta, right? Option C is the correct answer. Next question number 28. Which is a tool of nursing process? Which is a tool of nursing process? Option A is personal history. Option B is present illness. Option C is socio-economic status. Option D is planning. So which option is the correct answer? which is a tool of nursing process. Most important MCQ eta भी questions टा आसुची. Which is a tool of nursing process, right? मन रखिता. So correct answer is option D. Option D is the correct answer. कौन बेटा nursing process? What are the nursing process बेटा? Assessment, assessment, nursing diagnosis, planning, implementation, evaluations, these all are the nursing process. Next question, question number 29. Nurse use the nursing process as a method of option communication with patients and families. Option meeting public expectation of nurses. Option C planning, organizing and delivering patient care. Option D meeting the legal requirements and standard in nursing. So which option is the correct answer? फटाफट answer कर दो. Which option is the correct answer बेटा? Which option is the correct answer? फटाफट answer कर दियो. So correct answer is option C. Planning, organizing and delivering patient care. Option C is the correct answer. Next question. Question number 30. First way to assess a full thickness burn. First way to assess a full thickness burn. Option A observation. Option B auscultation. Option C palpation. Option D percussion. So which option is the correct answer? Beta फटाफट answer कर देला. Very important MCQ. First way to assess a full thickness burn. Right. Option A is the correct answer. Option A is the correct answer. Observations. NIMHANS Bangalore exam राइस्तिला बेटा ये questions NIMHANS Bangalore nursing officers exam 2019 रे ये questions पचारितला right. Next question, question number 31. Physical assessment is being performed by a nurse during the abdominal examination. Nurse should perform the 4 physical examination techniques in which sequence? Option A is auscultation immediately after inspections and then percussion and palpation. Option B is percussion following by inspection, auscultation and palpation. Option C is palpation of tender areas first and then inspections, percussion and auscultation. Option D is inspection and then palpation, percussion and auscultation. So which option is the correct answer? Physical assessment is being performed by a nurse during the abdominal examination. Nurse should perform 4 physical examination techniques in which sequence? Very important. Proper sequence रे हमें केमती abdominal examinations करिबा. Good evening, Kabir Malik. So which option is the correct answer, beta? So option A is the correct answer, right? Auscultation. Option A is the correct answer. Auscultation immediately after inspections and then percussion and palpation. So inspections first अब कौन inspections, then percussion, then palpation, तापर auscultation, right? केमती है वो? First inspections, then percussions, then palpation, then auscultation. So immediately after inspection and then percussion and palpation, tapre auscultation. So option A is the correct answer, right? Next question number 32 rachi. The type of assessment done to compare the client's current status to previously obtained baseline data is called. The type of assessment done to compare the client's current status to previously obtained baseline data is called. Option which is problem focused assessment, option which is time lapsed reassessment, option C which is emergency assessment, option which is initial assessment. So which option is the correct answer? फटाफट आंसर कर दे लो. So time lapsed reassessment are conducted after an initial assessment and treatment plan are in place to monitor the patient progress and how their condition is evolving. This type of assessment specifically involves comparing the current patient status to their baseline data, right? So option B is the correct answer. Haba beta time lapsed reassessment. Haba time lapsed reassessment. Haba option B is the correct answer. Next question number 33. The type of assessment that the type of assessment that includes data related to a client's biological, psychological, cultural, spiritual, and social needs is called. Option which is behavioral assessment, option which is screening assessment, option which is comprehensive assessment, option D which is focused assessment. So which option is the correct answer? फटाफट आंसर कर दो. Which assessment is the correct answer बेटा? So option C is the correct answer. Comprehensive assessment. Option C is the correct answer, right? Comprehensive health assessment involves gathering of data about clients' health, including biological, psychological, cultural, and spiritual and social needs, right? This is the complete health baseline data. Comprehensive assessment, comprehensive health assessment. Option C is the correct answer beta, right? Next question number 34. The following are the components of Glasgow Coma scale except, very important, except देखी questions आसिबो तितरे confused हेबार नाई. आंसर करूची. फर्स्ट अच्छी आई रेस्पॉन्स, ऑप्शन विच वर्बल रेस्पॉन्स, ऑप्शन सी कॉफिंग रेस्पॉन्स, ऑप्शन डी अच्छी मोटर रेस्पॉन्स. आंसर कर लो फटाफट आंसर करो. जो मैंने लाइव देखुछ ना फटाफट आंसर करो. समस्त आंसर करवा उचित. द फॉलोइंग आर द कंपोनेंट्स ऑफ ग्लासगो कोमा स्केल एक्सेप्ट आई रेस्पॉन्स, वर्बल रेस्पॉन्स, कॉफिंग रेस्पॉन्स, मोटर रेस्पॉन्स. फटाफट आंसर कर दियो. वेरी गुड सुमन मीन्स कॉफिंग रेस्पॉन्स. होप फॉर बेस कॉफिंग रेस्पॉन्स. ज्योति मंजरी ऑप्शन सी. सोनालिका ऑप्शन सी. तनुश्री पोहन ऑप्शन सी. रश्मि रेखा महाराणा ऑप्शन सी. वेरी गुड. कॉफिंग रेस्पॉन्स को छाड़ी देले बाकी तक ग्लासगो कोमा स्केल रा कंपोनेंट आई रेस्पॉन्स, वर्बल रेस्पॉन्स, मोटर रेस्पॉन्स. These three are the components of Glasgow Coma Scale or GCS component, right? Next question number 35. When examining a patient who is paralyzed below the T4 level, the medical surgical nurse expect to find option A impaired diaphragmatic function requiring ventilator support, option B facility of the upper extremities, option C independent use of the upper extremities and efficient cough, option D hyperplexia and spasticity of the upper extremities. So which option is the correct answer? So correct answer is option C, independent use of the extremities and efficient cough. Option C is the correct answer. Next question number 36. The tumor of the hyaline cartilage is called option A osteochondroma, option B osteosarcoma, option C enchondroma, option D chondrosarcoma. So which option is the correct answer beta? So correct answer is beta enchondroma. The tumor of the hyaline cartilage is called enchondroma, right? Enchondroma. And this tumor is originate in the cartilages, right? And this tumor is originate from the cartilage beta, right? So The tumor of the hyaline cartilage is called enchondroma. Enchondroma, right? So option C is the correct answer. Next question, question number 37. The name of the test used to check the purity of butter through estimation of volatile fatty acid is DS. Option A saponifications number, option B iodine number, option C acid number, option C Reichert-Michel number. So which option is the correct answer? RM number, right? So which option is the correct answer? The name of the test used to check the purity of butter through estimation of volatile fatty acid. So correct answer is the Reichert-Michel number. Option D is the correct answer. Mane rakhita. Right? Option D is the correct answer. Next question, question number 38. Point swelling with fever indicates a prolonged PR interval. Point swelling with fever indicates a prolonged PR interval. Right? Prolonged PR interval in ECG. Point swelling with fever indicates a prolonged PR interval in ECG. Option A diffuse atrial duct, option B atrial fibrillation, option C Fallot's quadrift, option D rheumatoid fever. So correct answer kaana hava beta? Correct answer is rheumatoid fever. Option D is the correct answer, right? This is the sign of a rheumatoid fever, rheumatic fever, or rheumatoid fever, rheumatic fever. Right, option D is the correct answer. Next question, question number 39. Which of the following codes is used to represent repressive episode H per ICD-10? बेटा psychiatric questions आ गया, इसमें भी घुस गया है. Option A F31, option B F32, option C F30, option D F28. So which option is the correct answer? So F30 to F39 mood affective disorder. जानी चाहिए ना बेटा, mood affective disorder, mood affective disorder, right ना? So which of the following codes is used to represent depressive episode H per the ICD-10? So option B is the correct answer. F32 is the depressive episode beta. F32 depressive episode. I use ICD coding. Depressive episode. Right? So option B is the correct answer. Next question. Which of the following disease can be diagnosed by NS1 kids? Very, very important. Mane rakhita. Which of the following disease can be diagnosed by NS1 kids? Option A dengue fever, option B lymphatic filariasis, option C malaria fever, option D typhoid fever. So which option is the correct answer? फटाफट answer कर दे लो. फटाफट answer कर दो. फटाफट answer करो. Most important MCQ. Option A is the correct answer. But dengue fever पे हमें NS1 kit से use कर ना. Next question, question number 41. Which of the following is an example of personality test? Which of the following is an example of personality test? Option A Rosca test, option B Stanford test, option C Wechsler's test, option D Binet test. So correct answer is Rosca test. Option A is the correct answer. Right. Next question, question number 42. Ridley and Jofling's classification is commonly used to classify. Option A leprosy, option B pink cup, option C leukemia, option is herpes zoster. So which option is the correct answer? Ridley and Joplin classification is commonly used to classify leprosy. Option A is the correct answer. Right. Next question, question number 43. A microfilaria test is a diagnostic procedure used to detect which of the following disease. Option is tuberculosis, option is measles, option is elephantiasis, option is mumps. So which option is the correct answer? A microfilaria test is diagnostic procedure used to detect elephantiasis or lymphatic filariasis. एलिफेंटासिस को कौन कहते हो बेटा? lymphatic filariasis, right? Option C is the correct answer. Next question, question number 44. The Paul Bonnell test is used in the diagnosis of option is infectious mononucleosis, option B is herpes zoster infection, option C is varicella zoster infection, option D is syphilis. So which option is the correct answer? फटाफट आंसर कर दिया. So the Paul Bonnell test is used in the diagnosis of infectious mononucleosis, right? So option A is the correct answer. And this is a serological test. This is a serological test to detect heterophil antibodies. To detect heterophil antibodies. Right? So option A is the correct answer. Next question, question number 45. Skin smear are primarily used in the diagnosis of which of the following disease? Option is Hansen disease, option is Raynaud's disease, option C is dengue fever, option is Burger's disease. So which option is the correct answer? फटाफट आंसर कर दो. Skin smears are primarily used in the diagnosis of which of the following disease? So correct answer is option A is the correct answer. Hansen disease is also known as what? Leprosy. Leprosy को हमें Hansen disease कहो छे, हाँ ना नहीं? So skin smears are primarily used in the diagnosis of Hansen disease, that is leprosy, हाँ ना नहीं? Next question, question number 46. What is the Clements-Sec test? What is the Clements-Sec test primarily used for? Choose the most appropriate option from below. Option is assessing fetal well-being, option B is detecting congenital hip dislocation, option C is evaluating fetal long maturity, option D is screening for gestational diabetes. So which option is the correct answer? Clements-Sec test. Clements-Sec test. So correct answer is beta option C, evaluating fetal long maturity. This is the Clements-Sec test primarily used for evaluating fetal long maturity, right? Question number 47. Which of the following is a projective psychological test? Which of the following is a projective psychological test in which patients' ink bolts are recorded and then analyzed using psychological interpretation, complex algorithms, or both? Option is Cage questionnaire, option is Hamilton scale, option is Frick even inventory, option is Rosca test. So which option is the correct answer? So correct answer is Rosca test. Rosca test is a psychological test in which the subject interpretation of ink blots are analyzed to examine personality characteristics and emotional functioning. Personality characteristics and emotional functioning. To examining personality characteristics and emotional functioning with the help of Rosca test. Right, option D is the correct answer. Next question, question number 48 अछि electroencephalogram test is used to measure which of the following? Option is heart rate, option is brain wave activity, option C is blood pressure, option is muscular strength. Most important MCQ easy questions thiba empty a type ro questions thiba तमान को answer करिवार अछि. So which option is the correct answer? Electroencephalogram test is used to measure what? Brain wave activity. Option B is the correct answer. No, option B is the correct answer. Very good. Very good. Next question. Question number 49. Gomez classification. Gomez classification is used to rule out. Very, very important. These questions be most important MCQ. Gomez classification is used to rule out option is obesity, option is malnutrition, option is underweight, option is malnourishment. So which option is the correct answer? Which option is the correct answer? फटाफट आंसर कर दिया. Which option is the correct answer? Gomez classification is used to rule out malnutrition. Malnutrition. Option B is the correct answer. मने रखी तो Gomez classification is used to rule out malnutrition in children. Protein energy malnutrition, PEM. Protein energy malnutrition in children. Gomez classification is used to categorize protein energy malnutrition in children on their weight according to their age. Next question, question number 50. What laboratory test is used to monitor disease progression and immunostatus in HIV positive patients? What laboratory test is used to monitor disease progression and immunostatus in HIV positive patients? Most important MCQ, beta, very, very important MCQ. Right? Very, very important MCQ. Option is CD4 plus T cell count, option B is liver function test, option C is complete blood count, option D is HIV viral load. So which option is the correct answer? फटाफट आंसर करो समझते. फटाफट आंसर कर दियो. Very good, very good, very, very good. CD4 plus T cell. CD4 plus T cell count. Option A is the correct answer, right? So हमें यही laboratory test को monitor करता हूँ, है ना नहीं? To monitor disease progression and immunostatus in HIV positive patients. CD4 plus T cell count. Next question, question number 51. Study of cells collected by fine needle aspiration, FNAC. करते ना FNAC. Fine needle aspiration of superficial and deep-seated lesion for diagnosis of pathological condition is termed HDS. Study of cell collected by fine needle aspiration of superficial and deep-seated lesion for diagnosis of pathological condition is termed H. Option is cytopathology, option is molecular pathology, option is medical genetics, option is hematology. So which option is the correct answer? Which option is the correct answer, beta? So correct answer is cytopathology. Option A is the correct answer. Very good. Fine needle aspiration cytology of FNAC. Take option A is the correct answer, right? Question number 52. The primary test to identify Pseudomonas aeruginosa in the laboratory HDS. The primary test is to identify Pseudomonas aeruginosa in the laboratory HDS. Option A is oxidase test positive. Option B is nitrate reduction test. Option C is coagulase test. Option D is catalase test. So which option is the correct answer? फटाफट आंसर कर दो. So correct answer is बेटा oxidase test. Oxidase test or oxidation test. Oxidase test or oxidation test. Next question, question number 53. Which diagnostics tool is mostly common used to confirm hydrocephalus? Very important. मन रखी तो बहुत important MCQ टा बेटा. Which diagnostic tool is most commonly used to confirm hydrocephalus? Option रही MRI of the spine, option रही angiography, option रही CT scan, option D रही EEG. So which option is the correct answer बेटा? हाइड्रोसेफेलस माने कौन बेटा? एबनॉर्मल एक्यूमुलेशंस ऑफ सेरेब्रोस्पाइनल फ्लूइड CSF है ना नहीं? एबनॉर्मल एक्यूमुलेशंस ऑफ सेरेब्रोस्पाइनल फ्लूइड विदिन द ventricles of brains है ना नहीं? That is hydrocephalus. So which option is the correct answer? कौन commonly करवा कथा हाइड्रोसेफेलस जानिबा पे डायग्नोस करवा पे? So correct answer is option C beta CT scan. मन रखता most commonly used to confirm hydrocephalus with CT scan. हैला option C is the correct answer. Very important MCQ मन रखता भूली जीवा नहीं, right? Very important MCQ. Next question, question number 54. Which of the following is used to classify aortic aneurysm? Aortic aneurysm. Which of the following is used to classify aortic aneurysm? Option A Duke's criteria, option B Jones criteria, option C D Becky criteria, option D Framingham criteria. So which option is the correct answer beta? So correct answer is option C, right? Option C is the correct answer. D Becky criteria. D Becky classification is used to categorize dissection which are closely related to aortic aneurysm. Aortic aneurysms, right? And when they involve in the thoracic aorta, and this is divided in this. It is divides dissection into three types beta, type 1, type 2 and type 3 रे हमें dissection करा जो three types रे, different types रे. It's divide dissections in three types, type 1, type 2 and type 3, right? Type 1 रे starts in the ascending and extend beyond the arch. In type 2 रे beta confined to the ascending aorta, and type 3 begins in the descending aorta and may extend downward, right? Type 1, type 2 and type 3. Next question, question number 55. Reynolds pentad is a set of 5 clinical signs seen in which of the following conditions? Reynolds pentad is a set of 5 clinical signs seen in which of the following conditions? First is encephalitis, option B is pancreatitis, option B is option C is cholangitis, option D is meningitis. Encephalitis, pancreatitis, cholangitis and meningitis. So correct answer beta cholangitis. So cholangitis, this is a serious infection of the biliary tract beta. This is the serious infections of biliary tract. Right? So option C is the correct answer. Next question, question number 56. Which is a visual indicator of increased blood flow to the promontory, which can be seen through the tympanic membrane during an otoscopic examinations, which is a visual indicator of increased blood flow to the promontory, which can be seen through the tympanic membrane during an otoscopic examinations. Option A Traube sign, option B Safer signs, option C Squarch sign, and option D Swash sign. So which option is the correct answer, beta? So option C is the correct answer, beta. Squarch sign is reddish hue seen over the promontory of the middle layer through the tympanic membrane during otoscopic examination. So option C is the correct answer, beta. This केमती दिसो बेटा reddish hue seen over the promontory middle layer, right, through the tympanic membrane during otoscopic examinations. A sign टा हमको square sign देखिए को मिलेगा बेटा. So option C is the correct answer. Next question number 57. Which of the following is an antimicrobial sensitivity test to detect the minimum inhibitory concentration of antibiotics? Option A Wentworth's test, option B Romhanil's test, option C epsiolometer's test, option C D Kaiserling test. So which option is the correct answer, beta? Beta DSSB examination, Delhi Subordinate Staff Selections Board examination रे आइस्तिला 2025 रे. difficult questions लागू तो बेटा ये सब questions सब state examination मानकर आवश्य ला मे बी नॉर्थ सेट एग्जामिनेशन मानकर भी आसी पारे. So which option is the correct answer, beta? Which of the following is an antimicrobial sensitivity test to detect the minimum inhibitory concentration of antibiotics? Most important questions, beta. माने रखे तो. So correct answer is option C. Epsiolometer test. This is the antimicrobial sensitivity test that detects the minimum inhibitory concentration of antibiotics. Right? Epsiolometer test or E-test. E-test. Right? Next question number 58. What is the minimum score of the Merz-Fall scale? Both important questions. Merz-Fall scale. It have DSSB examination questions. 2025 रो. What is the minimum score of the Merz-Fall scale? Option A 10, option B 0, option C 3, option D 5. So the minimum score on the Merz-Fall scale is 0, beta. 0, right? Option B is the correct answer, right? यदि Merz-Fall scale रा score यदि 0 to 24 हैला बेटा, this is low risk, right? And 25 रू 44 हैले बेटा moderate risk. मन रखी था, लिखी नहीं जाओ खतरे. Merz-Fall scale रा score in range केते बेले कौन high risk हबा, केते बेले low risk रहेबा, and minimum score केते हमको जाने वाला अच्छी. So 25 ru 44 हेले moderate risk and 45 or higher 45 or higher हेले high risk बेटा, high risk, right? So correct answer is option B. Next question, question number 59. A positive drop arm test indicates, a positive drop arm test indicates option A Pott's fracture, option B golfer's elbow, option C Colles fracture, option D rotator cuff injury. So which option is the correct answer? So correct answer is beta option D, rotator cuff injury. A positive drop arm test indicates a rotator injury. Rotator injury. आमे केते बेले जानिबा बेटा पॉजिटिव फाइंडिंग्स केते बेले आसीबो when your arm suddenly drops down or there is a weakness in maintaining an abducted positions during the test. This is positive findings, right? So rotator cuff injury is a positive drop arm test. Next question, question number 60. Johari window. Johari window is mainly used to assess which of the following? Most important MCQ. Self-awareness, option which is semantic memory, option C is intelligence, option which is attitude. So which option is the correct answer? So correct answer is beta option A, self-awareness. So Johari window is primarily used to assess self-awareness, primarily assess self-awareness, right? Option A is the correct answer. Next question, question number 61. Which test is used to identify the presence of occult blood in stool? Very, very important MCQ. Very, very important. Mane rakhiବାକୁ ପଡିବ. Now, which test is used to identify the presence of occult blood in stool? Option A benzidine test, option B Duke test, option C IV test, option D Benedict test. So which option is the correct answer? So correct answer is beta benzidine test. Benzidine test, this is a chemical test beta used to detect the presence of occult matter in feces or occult blood in stool or occult blood in feces. Right? Option A is the correct answer. Very good. Next question, question number 62. BUN used for kidney function test stand for. BUN used for kidney function test stand for. Very, very important. Mane rakhibo padibo. Easy, but amko mane rakhithibar achi. Option A blood uric acid nitrogen, option B blood uracil nitrogen, option C blood urea nitrogen, option D blood urine nitrogen. फटाफट आंसर कर लो बेटा. BUN रो फुल फॉर्म कोन हबो? BUN रो फुल फॉर्म आंसर करो, फटाफट आंसर करो. जो मैंने जानी चाहिए आंसर करो फटाफट, जल्दी आंसर करो, फटाफट आंसर करो. वेरी गुड. सोनालिका, गिरीश महापात्र, वेरी गुड बेटा, आंसर करो फटाफट. बहुत बढ़िया. सो करेक्ट आंसर इज ऑप्शन सी, ब्लड यूरिया nitrogen. Blood urea nitrogen. Option C is the correct answer ना. मैं कौन पे ये टेस्ट करचे बेटा? किडनी फंक्शन, इटा किडनी फंक्शन टेस्ट है, राइट? तो किडनी को मॉनिटर, किडनी डिजीज को मॉनिटर करवा पाए ये टेस्ट करूचे and evaluate to kidney function है ना, and assess the dehydration and nutritional status जानिबा पई हमें ये सब BUN करूचे है ना नहीं. To evaluate kidney functions, to monitor kidney disease, to assess dehydration and nutritional status. एथि पई BUN आमे यूज करूचे BUN टेस्ट करूचे right. Next question, question number 63. The NANDA's criteria are used to assess the NANDA's criteria are used to assess option A rachi epispadias in children, option B rachi congenital heart disease in children, option C is spina bifida in children, option D rachi gastroschisis in children. So which option is the correct answer? NANDA's. So correct answer is option B. Congenital heart disease in children. NANDA's criteria, NADAS. NANDA's criteria is used to assess the severity and management of congenital heart disease in children. To assess the severity and management of congenital heart disease in children. NANDA's criteria आमे use करूचे. Right. Next question. Question number 64. A cystometogram is done to assess the function of the DAS. But a very important. Right. Star mark कर दियो. एक questions को. Very important. Cystometogram is done to assess the function of the lungs, gallbladder, urinary bladder, prostate. So which option is the correct answer? फटाफट आंसर कर दो जो मन को आउट बेटा फटाफट आंसर कर दो. Cystometogram test is done to assess the function of urinary bladder. Urinary bladder माने रखी था urinary bladder. Most important MCQ. Cystometogram is done to assess the function of the urinary bladder. Next, which medication should not be administered in treatment of CSF in lumbar function? Option A anti-inflammatory, option B steroid, option C antibiotics, option D anesthetics. So which option is the correct answer? So steroids should not be administered in the treatment of CSF leakage from a lumbar puncture. Right? Steroid ame daba nahi. Option B is the correct answer. Steroids should not be administered in the treatment of CSF leakage resulting from a lumbar punctures. Right? So ame steroid daba nahi. Next question. Question number 66. Contraindication of nasal intubations. Contraindication of nasal intubations. Option A conscious patient, option B fracture of base of skull, option C patient with limited mouth opening, option D intraoral mass. So which option is the correct answer beta? Which option is the correct answer? So correct answer is fracture of base of skull. So correct answer is option B. Contraindication of nasal intubation is fracture of base of skull. So contraindications of nasal intubation is fracture of base of skull due to the risk of endotracheal tube entering the cranial cavity, cranial activity through the fracture site, right? So it can lead to severe complication including brain injury and infections, better, right? So option B is the correct answer, right? Next question, question number 67. The best position for doing lumbar puncture is better, most important MCQ. Best positions for doing lumbar puncture. Best position for doing lumbar puncture is option A left lateral, option B right lateral, option C Fowler positions, option D prone positions. Answer कर दियो. So correct answer is option A, right? Left lateral position. Next question, question number 68. The translumination procedure is done with option A venipuncture, option B venipuncture, option B angiography, option C blood culture, option D bone marrow aspirations. So which option is the correct answer? Which option is the correct answer, beta? Answer कर दिया. The correct answer is option A, venipuncture. The translumination procedure is done with venipuncture. Next question. Question number 69. The aniline chloride test is used to detect food adulteration in option A black pepper, option B honey, option C ghee, option D pulses. So which option is the correct answer? The correct answer is beta option B is the correct answer, honey. Aniline chloride test is used to detect adulteration in honey. Adulteration in honey. Next question. Question number 70. The purpose of Weber test is to assess option A ear conduction, option B bone conduction, option C inflammation, option D infections. So which option is the correct answer, beta? So the Weber test is a screening test for hearing. Weber test is used to assess, and this is a screening test for hearing. So option A is ear conduction, option B is bone conduction, option C is inflammation, option D is infections. So which option is the correct answer, beta? So correct answer is bone conduction. Option B is the correct answer, right? Option B is the correct answer. Next question, beta. Question number 71. A group of symptoms is known as option A signs, option B syndrome, option C clinical manifestation, option D Burger test. So which option is the correct answer, beta? A group of symptoms is known as syndrome. Option B is the correct answer. Option B is the correct answer, right now. Next question. The normal range of CVP is beta already mu कही सारी तम मन को आंसर करने पड़ो. ऑप्शन रही 5 to 15 cm H2O, ऑप्शन बी 10 to 15 cm H2O, ऑप्शन सी 5 to 10 cm H2O, ऑप्शन डी 10 to 20 cm H2O. So which option is the correct answer? The normal range for central venous pressure. Which option is the correct answer? आंसर करो बेटा, फटाफट आंसर करो, फटाफट आंसर करो. Very good, Jyoti Manjari. Very good, Jyoti Manjari Jyoti. Option C is the correct answer. 5 to 10 centimeter of water H2O. 5 to 10 centimeter H2O. That is the normal range for central venous pressure. Right? Option C is the correct answer. Next question, question number 73. A normal person has a CD4 T cell count of normal person CD4 T cell count कितने रहेगा बेटा? Option A 100 to 150 cells per ml. Option B 150 to 175 cells per ml. Option C 450 to 1200 cells per ml. Option D 50 to 100 cells per ml. Which option is the correct answer? Most important MCQ मान रखी था. लिखी नहीं जाओ निजर खातारे निजर कॉपी रे लिखी जाओ. So correct answer is 450 to 1200 cells per ml. This is the normal CD4 cell count. This is the normal CD4 cell count beta. Option C is the correct answer. Next question, question number 74 is which radioactive substance used in cup tea or copper tea? Sorry, which radioactive substance used in copper tea? Cup tea. So option A is barium sulfate, option B is copper sulfate, option C is calcium sulfate, option D is magnesium sulfate. So correct answer is barium sulfate. Option A is the correct answer. Barium sulfate is a radioactive substance used in cup tea. Right? Barium mill or barium swallow procedure रे visualize करवा पाए कोडे visualize करवा पाए digestive tract रे right ये radioactive substance गुड़ा का use करा जाऊँ बेटा copper tea ने cup tea टा बेटा copper tea नो cup tea CUPT cup tea right copper tea नो cup tea digestive tract रे barium swallow procedure करा जाए barium mill प्रोसीजर करा जाए ना बेटा सो को सब्सटेंस देखी करा हो बेटा बेरियम सल्फेट सब्सटेंस देखी करा हो राइट नेक्स्ट क्वेश्चन व्हिच ऑफ द फॉलोइंग एडिटिव्स यूज्ड इन ब्लड शुगर ग्लूकोज व्हाइल इन लैबोरेटरी व्हिच ऑफ द फॉलोइंग एडिटिव यूज्ड इन ब्लड शुगर ग्लूकोज व्हाइल इन लैबोरेटरी very important MCQ which option is the correct answer Option A is sodium chloride, option B is sodium bicarbonate, option C is sodium fluoride, option D is sodium citrate. So which option is the correct answer? बेटा आंसर करो सोडियम फ्लोराइड ना साइट्रेट बेटा सोडियम फ्लोराइड ना ऑप्शन सी इज द करेक्ट आंसर ना बेटा ब्लड शुगर और ब्लड ग्लूकोज हमें पठौचे जो लैबोरेटरी को भाइल रे सोडियम फ्लोराइड भाइल रे ना ग्रे कलर भाइल रे ग्रे कलर था है ना माने पड़ुची ना नहीं Next question, question number 76. Just before cardiac arrest, which ECG abnormality is seen in the patient? Just before cardiac arrest, very important MCQ. Just before cardiac arrest, which ECG abnormality is seen in the patient? AF and atrial fibrillation, option B is ventricular tachycardia, option C is dysarrhythmia, option D is irregular dysarrhythmia. So which option is the correct answer, beta? So correct answer is beta ventricular tachycardia. Option B is the correct answer. Just before cardiac arrest, which ECG abnormality is seen in the patient? That is ventricular tachycardia. Ventricular tachycardia. Option B is the correct answer. Next question, question number 77. A person agrees with the organ donation before transplantation. Which thing should be done a priority? Option A, consent from family member. Option B, blood relation. Option C, biochemical cross matching. Option D, viral markers profile. So which option is the correct answer? फटाफट आंसर कर दे बेटा. So correct answer is beta option C, biochemical cross matching. Right, a person agrees with the organ donation before transplantation. Which things should be done a priority? Biochemical cross matching. So option C is the correct answer. So biochemical cross matching को आओ कौन कहते बेटा? Human leukocyte कौन कहते? Human leukocyte, human leukocyte antigen cross matching, antigen cross matching, right? Biochemical cross matching is otherwise known as human leukocyte antigen cross matching. Donor and recipient compatibility करा जाए बेटा, सेटा होची ह्यूमन ल्यूकोसाइट एंटीजन क्रॉस मैचिंग और बायोकेमिकल क्रॉस मैचिंग इन ऑर्गन डोनेशंस दुई जनकर जेमती आम ब्लड ट्रांसफ्यूजन ब्लड लगेवा पूर्व ट्रांसफ्यूजन करवा पूर्व क्रॉस मैचिंग करूछे ना नहीं ब्लड क्रॉस मैचिंग सेमती ऑर्गन डोनेशन जो होची कि ऑर्गन ट्रांसप्लांटेशन जो होची से समय रे भी डोनर एंड रेसिपिएंट रो क्रॉस मैचिंग हुए ताको कहा जाए बायोकेमिकल क्रॉस मैचिंग और ह्यूमन ल्यूकोसाइट एंटीजन क्रॉस मैचिंग. ऑप्शन सी इज द करेक्ट आंसर, राइट. Next question, question number 78. What is the minimum amount of urine that must be collected for culture and sensitivity urine specimen for? Very very important question. Silly questions, easy questions, but हमको जानने को पड़ेगा. What is the minimum amount of urine that must be collected for culture and sensitivity urine specimen for? Option लीजिए 5 ml, option लीजिए 10 ml, option लीजिए 20 ml, option लीजिए 15 ml. यूरिन कल्चर पे हमको मागी थिबे ताहले हम गोटे बोतल धर के जीवा कि स्टूल एग्जामिनेशन पे कहि थिबे पूरा बोतल डब्बा रे फुल करके नै थिबा पूरा माउथ रो पूरा ओवरफ्लो हो जाउतबो सेमती करी नवर अछि कि नहीं ना बेटा. तो केते अमाउंट केते एमएल हमको नै कि जीवार अछि आंसर कर दियो. मिनिमम अमाउंट, minimum at least 10 ml हवार अछि. very good, 10 ml at least हवार अछि बेटा. minimum 10 ml हवार अछि, ताटो अधिक हवार नै. बुझी पला नै. Next question, question number 79. Which assessment done by LARC? Which assessment is done by LARC? LARC, long action, reversible contraception, long action reversible contraceptions. Which assessment done by long action reversible contraception, that is LARC? Option is contraceptive, option B is gestational age, option C is fetal maturity, option D is cervical dilation. So which option is the correct answer beta? Full form जानी गला माने आराम से आंसर करि परिबो. करेक्ट ऑप्शन इज ऑप्शन ए contraceptive, right? Contraceptive. So before starting a LARC method, the healthcare professional will assess your general health and suitability for chosen method, including contraceptions, STI screening results, and X-ray, ultrasound to locate existing implants or IODs. So option E is the correct answer. Next question. Question number 80. If a patient done the Mantox test, and a patient has been suffering from HIV, what value indicate the TB infection in the patient? Option A 5, option B 7, option C 11, option D 15. So which option is the correct answer? In HIV positive patients, Mantox tuberculin skin test is considered positive if in duration is greater than 5. Duration is greater than 5 mm. Right? So option A is the correct answer. Option A is the correct answer haba beta. 5 ହେଇଗଲା means beta ଆମେ ଜାଣି दबा जे patient in TB infections greater than 5 or 5 ହେଇଗଲା means 5 mm ହେଇଗଲା means with HIV positive patients beta. I mean in case of HIV patient को होची beta, not normal patients. जो patient suffering from HIV तारो मेंटक्स टेस्ट जदि ग्रेटर देन 5 mm ହେଇଗଲା ताहले हमें जानिबा कि पेशेंट पॉजिटिव अछि ट्यूबरकुलोसिस पॉजिटिव अछि बोली जानिबा राइट. Lana, in normal case greater than 10 mm. HIV patient greater than 5 mm. Right? बुझी पल्ला तो and healthy patient रा कितने रहेगा 0 to 4 mm. This is normal. And यदि greater than 10 mm ହେଇଗଲା ताहले positive ହେଲା TB positive. In normal patients greater than 10 mm हेले positive TB अछि बोले जानिबा. And normal केते बेले हमें जानिबा 0 to 4 mm भीतर जते रहिला tuberculin test और mentox test हला ताहले हमें जानिबा कि this is negative result, right? Next question number 82. Which of the following test is specific diagnostic test for disseminated intravascular coagulation DIC? Option is PT, option is INR, option is D-dimer, option D is bleeding time, clotting time. So which option is the correct answer? अरे यार यार क्वेश्चन आंसर डिस्कशन करा ही ना हो. क्वेश्चन नंबर 81. Which test is to monitor vaccine potency? Which test is used to monitor vaccine potency? Option A is Mantox test, option B is SEC test, option C is Hill test, option D is modified Hodge test. So correct answer कौन होगा बेटा? SEC test, right? SEC test. The SEC test is used to monitor the potency of vaccines, potency of vaccine, potentiality of vaccines. ना नहीं SEC test is very important बेटा मन रखता है. SEC test is used to monitor the vaccine potentiality, vaccine potency, right? Option B is the correct answer. Next question number 82. Which of the following test is specific diagnostic test for disseminated intravascular coagulation? DIC. Option A PT. Option B INR. Option C D dimer. Option D bleeding time, clotting time. So which option is the correct answer? फटाफट आंसर कर दो बेटा. So correct answer is बेटा option C. D dimer test, right? DIC full form disseminated intravascular coagulations. डायग्नोसिस करबा पय हमको डी डाइमर टेस्ट करबा को पड़े बेटा. हमको जब एक्यूरेटली जानवर अच्छे ताले हमको डी डाइमर टेस्ट मोस्ट इंपोर्टेंट फॉर DIC. नेक्स्ट क्वेश्चन नंबर 83. ECG changes in hyperkalemia condition. ECG changes in hyperkalemia condition. Option A prominent U wave, shallow T wave and ST segment diffraction. Option B QRS complex wide, prolonged PR interval. Option C QRS complex wide, flat P wave, dull peak T wave and ST segment diffraction. Option D prominent U wave, dull T wave and ST segment diffraction. So which option is the correct answer beta? In hyperkalemia ECG केमती चेंजेस हो बेटा कौन होबो? QRS complex wide होबो, flat P wave रहबो, dull peak T wave रहबो and ST segment diffraction रहबो. So option C is the correct answer. Option C is the correct answer. These findings जब ECG रहला ताले हमें जानेबा this is the characteristics of hyperkalemia. Right, option C is the correct answer. Next question number 84. What is the normal CPP? What is the normal CPP? What is the normal CPP? CPP कौन है बेटा? Cerebral perfusion pressure. Cerebral perfusion pressure. Cerebral perfusion pressure, CPP. So what is the normal cerebral perfusion pressure? बेटा खातर लिखनी हो, नोट डाउन करो. What is the normal CPP? What is the normal CPP? Cerebral perfusion pressure. Option A 50 to 60 mm of Hg. Option B 70 to 80 millimeter of mercury. Option C 30 to 40 millimeter of mercury. Option D 70 to 100 millimeter of mercury. So which option is the correct answer beta? So CPP हमें केमती देखिबा बेटा? CPP हमको केमती मेजर करबा पड़िबा बेटा? CPP is the difference between the mean arterial pressure MAP, mean arterial pressure and intracranial pressure. Right, मन रखे तो difference between mean arterial pressure and intracranial pressure. MAP minus ICP, CPP. हेला तो करेक्ट आंसर कहते हैं बेटा? ऑप्शन बी इज द करेक्ट आंसर. 70 to 80. Very good, Girish Mahapatra. 70 to 80 is the normal cerebral perfusion pressure. Very good. Option B is the correct answer. Next question number 85. Which ECG lead is best for measuring arrhythmia? Option A is V1, option B is V2, option C is V5, option D is V4. So which option is the correct answer? So correct answer is V2. V2 ECG leads is best for measuring arrhythmia. V2. Right. Next question. Question number 86. Mantox test is used for. Option H is screening test for asthma. Very important. Mantox test is used for screening test for asthma. Option B is screening test for COPD. Option C is screening test for emphysema. Option D is screening test for tuberculosis. So which option is the correct answer beta? फटाफट आंसर कर दे. सो करेक्ट आंसर इज तमे माने समझते जानि स्क्रीनिंग टेस्ट फॉर ट्यूबर. Option D is the correct answer. Next question, question number 87. Which test is used to confirm COVID-19 positive case? Option A HRCT, option B D dimer, option C RT-PCR, option D chest X-ray. फटाफट आंसर कर दियो बेटा. Which test? अरे यार आंसर करो. सोनालिका, गिरीश महापात्र, ज्योति मंजरी ज्योति, गिरीश महापात्र, आर्टिफिशियल. वेरी गुड. ऑप्शन सी इज द करेक्ट आंसर. आर्टिफिशियल टेस्ट इज used to confirm COVID-19 infections. है ना? So option C is the correct answer. Next question, question number 88. A patient AVG result is pH 7.48. Partial carbon dioxide 32, partial oxygen level is 88, and bicarbonate is 24. According to this result, patient suffering from option is respiratory acidosis, option B respiratory alkalosis, option C metabolic acidosis, option D metabolic alkalosis. So which option is the correct answer बेटा? pH नॉर्मल अच्छी बेटा, pH नॉर्मल है कि नहीं है? pH कौन अच्छी? pH is equal to 7.48. बॉडी से ना कमी ची, एलिवेटेड अच्छी, इंक्रीज्ड अच्छी. देन PCO2 32, PCO2 32. तो ये कौन अच्छी? PCO2 नॉर्मल कितने बेटा? 35 to 45 mmHg है ना? नहीं माना अच्छी ना? नहीं भूल गलो. pH रो 7.35 to 7.45, 7.35 to 7.45 है ना? नहीं. Then bicarbonate HCO3 कितने अच्छी बेटा? 24. HCO3 रो रेंज कितने बेटा? 22 to 26 मिली इक्विवेलेंट पर लीटर है ना? नहीं. तो HCO3 नॉर्मल अच्छी, नॉर्मल रेंज रो अच्छी ना. HCO3 24 अच्छी मीन्स नॉर्मल रेंज रो अच्छी. PCO2 कौन है जी? डिक्रीज ठीक अच्छी, डिक्रीज ठीक अच्छी ना. pH इनक्रीज हैला ताहले कौन? अल्कोलिसिस है ना? नहीं. एंड ये कहा से पार्टिसिपेट करे? PCO2 और पार्शियल कार्बन डाइऑक्साइड कहा से पार्टिसिपेट करे? रेस्पिरेटरी सहित है ना? नहीं. तो कौन हम भाई जेहेतु डिक्रीज अच्छी, ऑपोजिट हुए ना. आर ओ हुए ना. आर ओ रे रेस्पिरेटरी ऑपोजिट, मेटाबॉलिक रे इक्वल रहे है ना? नहीं. इनक्रीज अच्छी, डिक्रीज अच्छी, ऑपोजिट होची ना. pH इनक्रीज अच्छी, PCO2 डिक्रीज अच्छी. तो कौन हम? रेस्पिरेटरी अल्कोलोसिस हवा. ऑप्शन बी इज द करेक्ट आंसर. रेस्पिरेटरी अल्कोलोसिस हवा है ना? नहीं. नेक्स्ट क्वेश्चन, क्वेश्चन नंबर 89. when analyzing the serum laboratory report, sorry, analyzing when analyzing the serum laboratory report for a patient diagnosed with lung cancer that has metastasis to the pelvic bone, which findings should nurse anticipate? Option A elevated calcium, option B decreased hemoglobin, option C elevated creatinine, option D elevated creatine kinase. So which option is the correct answer? Which option is the correct answer? Correct answer is beta option A. Option A is the correct answer. Elevated रहिबा calcium level, right? Hypercalcemia हवा, hypercalcemia रहिबा, hypercalcemia रहिबा. Next question, question number 90. A patient is scheduled for a outpatient electroencephalogram EEG. Nurse instruct the client to prepare for the test by option A removing all hairpins, option B avoiding eating or drinking at least 6 hours prior to the test, option C being prepared to have some of the scalp saved, option D having blood drawn for a glucose level 2 hours before the test. So which option is the correct answer? बेटा फटाफट आंसर कर दो. So correct answer is बेटा option A removing all hairpins, right? The client schedule for outpatient electroencephalogram EEG. Nurse instruct the client to prepare for the test by removing all hairpins. Option A is the correct answer. Next question, question number 91. Which of the following is a differentiating test between mucus and cerebrospinal fluid from a nasal discharge? Which of the following differentiating test between mucus and cerebrospinal fluid CSF from a nasal discharge? Option A specific gravity, option B protein, option C microorganism, option D glucose. So which option is the correct answer? बेटा फटाफट आंसर कर दे. So which option is the correct answer? So correct answer is बेटा glucose, right? Option D is the correct answer. Our next question, question number 92. In ECG, V1 electrode is placed in which intercostal space? In ECG, V1 electrode is placed in which intercostal space? Option A is first, option B is second, option C is third, option D is fourth. So correct answer is beta fourth. Option D is the correct answer. So in ECG, the V1 electrode is placed in the fourth intercostal space at the right sternal border. At the right sternal border. Right. Next question, question number 93. Patient has not passed urine in last 24 hours. Patient has not passed urine in last 24 hours. It is termed as option anuria, option which polyuria, option C which oliguria, option D which none. So which option is the correct answer? Beta फटाफट आंसर कर दो. Patient has not passed urine in last 24 hours. It is termed as. फटाफट आंसर कर लो बेटा, फटाफट आंसर करो. जो मैंने वीडियो को देखो जाओ से मैंने आंसर करा बेटा. इजी क्वेश्चंस, ये सब क्वेश्चंस आसिबो एग्जाम रे. वेरी गुड गिरीश, सोनालिका, रंजू, सॉरी रानो जी, मंगराज, ज्योतिर्मयी. वेरी गुड, बहुत बढ़िया. एनुरिया हवा करेक्ट आंसर. एनुरिया is the absence or low flow output of urine, right? Option A is the correct answer. Next question, question number 94. There is 10 to 15 pus cell in routine examination of urine. There is 10 to 15 pus cell in routine examination of urine. What it indicates? Option A normal, option B kidney disease, option C urinary tract infection, option D none. So which option is the correct answer, beta? Which option is the correct answer? So correct answer is urinary tract infections. So there is 10 to 15 pus cell in a routine examination of urine. What it indicates, that is urinary tract infections. 10 to 15 pus cell or 10 to 15 leukocytes. Right? Option C is the correct answer. Next question, question 95. Which of the following is the best diagnostic test? Which of the following is the best diagnostic test for detecting peptic ulcer? Beta, very important MCQ mane rakhi tha. Very important MCQ. Option A barium meal study, option B ultrasonography USG, option C X-ray study, option D endoscopy. So which option is the correct answer? फटाफट आंसर कर लो बेटा, फटाफट आंसर करो. Which of the following is the best diagnostic test for detecting peptic ulcer? Peptic ulcer हेतले बेटा हमें को डायग्नोस्टिक टेस्ट माध्यम रे हमें जानिबा कंफर्म कि पेप्टिक अल्सर हेछि बोली. वेरी गुड. सुचित्रा ऑप्शन डी, रानोजी मंगराज ऑप्शन डी. वेरी गुड. ऑप्शन डी इज द करेक्ट आंसर. एंडोस्कोपी माध्यम रे ही हमें जानु छै, कहीं ना डायरेक्टली विजुअलाइज हबो इसोफेगस, स्टोमक एंड ड्यूडेनम को हमें देखु छै. विद द हेल्प ऑफ एंडोस्कोपी रे हमें कोन देखु छै, इसोफेगस को देखि पारु छै, स्टोमक को देखि पारु छै एंड डिओडेनम को मध्य डिओडेनम को मध्य देखि पारछे जदि किछि अल्सर से आइडेंटिफाई हे जिवो हां ना नहीं so the best diagnostic test for detecting peptic ulcer is endoscopy. Option D is the correct answer. Next question beta, question number 96. Barium enema is used mainly for radiological examination of the barium enema is used mainly for radiological examination the brain, colon, heart, oral cavity. Very important MCQ माने रखे था बेटा, very important MCQ, 5-star MCQ. Brain, colon, heart, oral cavity. Barium enema is used mainly for radiological examination of the brain, colon, heart, and oral cavity. So which option is the correct answer? Which option is the correct answer beta? Which option is the correct answer? So correct answer is, फटाफट आंसर कर दियो बेटा, फटाफट आंसर कर दियो. Option B is the correct answer. Very good. Option B, ज्योति मंजरी, ज्योति. Very good. Option B is the correct answer बेटा. अरे प्रदीप तो गोड़ कुआड़े कुआड़े पळौछ, आंसर भी करो ना, देखुछ ना नहीं लाइव. सोनालिका. ऑप्शन बी, गिरीश महापात्र, कोलन. वेरी गुड बेटा, ऑप्शन बी is the correct answer. Next question, question number 97. Which of the following tests need to be performed before radial artery cannulation to evaluate radial and ulnar arterial patency? Option A Cope's test, option B Allen test, option C capillary refill test, option D Borger's test. So which option is the correct answer? Which option is the correct answer? But very important is AMCQ be very important. I'm going to this is 5-star MCQ. So which of the following test is need to be performed before radial artery cannulation to evaluate radial and ulnar patency? So correct answer is Allen test beta. Option B is the correct answer. Allen test. Very good Madhusmita Sahu. Very good. Allen test is the correct answer. Pradipta Goda. Very good beta. Next question, question number 98. The visual examination of the cervix and vagina by special instrument is called. Most important MCQ, most important MCQ, very important MCQ, 5-star MCQ. The visual examination of the cervix and vagina by special instrument is called. Option A colposcopy, option B heteroscopy, option C laparoscopy, option D salpingoscopy. So which option is the correct answer? Which option is the correct answer beta? So correct answer is Girish Mahapatra, Monalisha Malik, Suchitra. Option A. Very good. Option A is the correct answer. So colposcopy रे आमे ही जानी पारिबा, विजुअलाइज करि पारिबा सर्विक्स एंड वेजाइना को, राइट. Next question, question number 99. The patient is posted for intravenous pyelogram. Which of the following is correct interventions? The patient is posted for intravenous pyelogram. The patient is posted for intravenous pyelogram. Which of the following is a correct interventions? Option A administer analysis. Option B administer sedatives. Option C assess for iodine sensitive. Option D encourage fluid intake. So which option is the correct answer? इंट्रावेनस पाइलोग्राम इज कॉल्ड बेटा आउ कौन भी कहती या को इंट्रावेनस यूरोग्राम मध्य कहती. इंट्रावेनस यूरोग्राम मध्य कह, यूरोग्राम मध्य कह. एंड दिस इज ए रेडियोलॉजिकल प्रोसीजर बेटा. दिस इज ए रेडियोलॉजिकल प्रोसीजर. व्हिच ऑफ द फॉलोइंग इज ए करेक्ट इंटरवेंशंस? Option A administer analysis. Option D administer sedatives. Option D assess for iodine sensitivity. Option D encourage fluid intake. So which option is the correct answer? So and this is a radiological procedure and it can be used to examine the kidney and ureters beta. Examine the kidney and ureters. So intravenous pyelogram or intravenous urogram, and it uses iodine containing material into the body through vein to the view X-ray of the kidney, ureters and bladders. iodine material यूज करा जाए बेटा. iodine containing material यूज करी कि हमें कौन करूचे बेटा, वेन माध्यम रे पुश करी कि आम विजुअलाइज कर एक्सरे माध्यम किडनी KUB किडनी ureters and bladder, right? SS for iodine sensitivity. So correct answer is option C. Last question beta ajikar class ra last question, which test is used when check the collateral circulation to the hand? Which test is used to check the collateral circulation to the hand? Option is Rumbuck's test, option B is Skamroth test, option C is capillary refill test, and option D is Allen test. Which option is the correct answer? Rumbuck test, Skamroth's test, option C is capillary refill test, option D is Allen test. Which option is the correct answer beta? Which test is used to check collateral circulation to the hand? So correct answer is beta Allen tests, right? Allen test is used to check the arteries and blood flow in the arms. Allen test हमें कौन check करचे? To check, it is used to check the arteries and blood flow in the arms, right? So correct answer is option D, Allen test beta. Thank you so much to one and all जो मैंने आज का लाइव क्लासेस ज्वाइन है, जो मैंने पर्यंत लाइव क्लासेस को लाइक करना बेटा लाइक कर दियो, एवं जो मैंने फर्स्ट टाइम चैनल को देखो निहाती भाव चैनल को सब्सक्राइब कर दियो। हमारा महा मैराथन क्लासेस चलती कंटिन्यू बेटा 30 डेज रो है। सो ऑलरेडी आम कवर अप कर सारे केते दिन क्लासेस बेटा 21 डेज कवर अप कर सारी, जो मैंने प्रीवियस महामाराथन क्लासेस देखी ना सी सब मध्य देखी नहीं जीवा बेटा, सी सब प्रत्येक टी क्लासेस इंपोर्टेंट फॉर आवर अपकमिंग OSSC नर्सिंग ऑफिसर्स एग्जाम, राइट? ओके बेटा, गॉड ब्लेस यू टू ऑन एंड ऑल, राइट? एंड स्टे मोटिवेटेड बेटा एंड कंटिन्यू करी था बेटा स्टडी टा केबे भी बंद करने बेटा, जे पर्यंत एग्जामिनेशन है मु डेली कहबी तब मन को कंटिन्यूअसली पढ़िबा को पड़िबो हैला, बुक रू भी पढ़ एवं लाइव क्लासेस रे भी जॉइन हो। थैंक यू सो मच टू वन एंड ऑल वन सेकेंड बेटा, एंड गॉड ब्लेस टू वन एंड ऑल। प्रत्येक जन जो मैंने लाइव क्लासेस से जॉइन हो मोर ब्लेसिंग रहा कि तुम मैंने निहाती भाव में जड़े भल नर्सिंग ऑफिसर हिसाब से जॉइन कर एज ए गवर्नमेंट नर्सिंग ऑफिसर्स बहुत जल्दी तुम यही स्वप्न साकार होगा जाऊँ बेटा। तो तापाई हमको निहाती भाव में काम करने को पड़ो, तापाई हार्डवर्क करने को पड़ो, तापाई पाठ पढ़ा को पड़ो है। ओके ना? सो आजिकार क्लास रे एतिकी बेटा, नेक्स्ट क्लास पुणी थे देखा हम, से पर्यंत टेक केयर एंड बाय बाय बेटा, एंड ऑल द बेस्ट फॉर योर अपकमिंग OSSC नर्सिंग ऑफिसर एग्जाम्स।